Assalamu alaikum. I am Alishba Tahir, belonging to group number 2. My roll number is 23, and the topic which was given to us was interpretation of clinical laboratory test. The subtopic which I have chosen from the topic is enzymes. Before moving forward, we must know that what are enzymes and how do they work. So, an enzyme is a substance that acts as a catalyst in living organisms, regulating the rate at which chemical reactions proceed without itself being altered in the process. Enzyme is any substance that is acting to regulate the chemical reactions inside the living body, but they are themselves not altered in the process. The biological processes that occur within all living organisms are chemical reactions, and most are regulated by enzymes. Enzymes mostly work by lessening and decreasing the activation energy of the process. Importance of enzymes in clinical laboratory test. Abnormal levels of plasma enzymes are highly suggestive of damaged cells and provides clues to parts of body that may be involved in disease processes. When the levels of enzymes are disturbed, they are clearly suggesting that the body is having some kind of issue that needs to be addressed immediately. Enzymes levels are measured in the clinical laboratory to identify the site of damage and to quantify the amount of damage. So now let's discuss the enzymes that are key markers of some diseases. The most important enzymes that are the key markers of diseases are creatine kinase, troponin, myoglobin, homocysteine, lactate dehydrogenase, brain natriuretic peptide, and C-reactive protein. Today we will discuss about creatine kinase. Why should we get tested for creatine kinase? To detect and monitor muscle damage, to help diagnose conditions associated with muscle damage, for heart attack detection. This test has been largely replaced by troponin TNI markers more specific to cardiac issue. That means that creatine kinase is mostly tested when the patient is having certain kind of cardiac tissue and cardiac tissue problems. However, it may sometimes be used to help detect a second or subsequent heart attack. When the patient is suffering from angina or pain towards the chest area, the creatine kinase levels may be disturbed. When to get tested? When you have muscle weakness, muscle aches, or dark urine and your healthcare practitioner suspects muscle damage. Sometimes to monitor for muscle injury resolution or persistence too. You must get tested for creatine kinase levels when you are having any muscle problem or any heart problem. So now we continue this that what kind of sample is required. A blood sample drawn from a vein in your arm is required. The test preparation which we need to do is none. We do not have to prepare prior to testing. We just have to go to the laboratory and we just have to give our blood sample for the testing procedure. So creatine kinase or creatine phosphokinase is an enzyme chiefly found in the brain, skeletal muscles and heart. An elevated level of creatine kinase is seen in heart attacks when the heart muscle is damaged or in conditions that produce damage to the skeletal muscles or brain. Creatine kinase is often incorrectly referred to as creatinine kinase, so the difference between the two must be monitored by the physician. And what is elevated creatine kinase? There are three different forms of creatine kinase that can be measured. It's CKMM, which is located in the skeletal muscles and heart. It's CKMB, which is located in the heart, and CKBB, which is located in the brain. An elevated level of creatine kinase in these certain types of areas, um, specifically CKMB, occurs within hours of a heart attack as the heart muscle cell die. That means that uh, when the myocardial infarction or heart attack occurs, the creatine kinase level remains normal, but after some time they started to rise. As the heart muscle cell die, the enzyme level continues to rise for the first 18 to 24 hours after a heart attack and slowly returns to normal after a few days. If creatine kinase is elevated, a more specific test, which is troponin, can help confirm the presence of a heart attack. Trauma and other conditions that damages the skeletal muscles are also associated with an elevated creatine kinase level. In some cases, the test may be used to detect muscle conditions as well, such as myositis, which is a condition that is characterized by the inflammation of muscles, or to estimate the degree of muscle damage. Stroke and other forms of brain damage can also result in an elevated creatine kinase level. An elevated kinase level can also signal a heart attack or any other emergency such as liver failure. Now we have a case study which we have to discuss is related to the heart disease and CK and CKMB levels. So SG is a 44-year-old woman. She appears at the emergency department of a local hospital with complaints of sudden onset chest pain, diaphoresis, and nausea that began about an hour ago. SG describes her pain as severe and not relieved by position change, antacids, or nitroglycerin. That means that none of the things mentioned here are helping her. An electrocardiogram, which is an ECG, reveals changes consistent with an acute myocardial infarction. The total serum creatine kinase concentration is 118 units per liter and normal is less than 150. That means that it is normal. And the CKMB is 5 units per liter, which is normally less than 12. SG was admitted to the coronary care units to rule out an acute myocardial infarction. We have been asked that why are the total CK and CKMB serum concentration within normal range in SG despite clear evidence that she is having a acute myocardial infarction. So let's go towards the SOAP notes, which are designed for our easier assessment of the case study. So first of all, we have to uh, see the objective. Okay, so the subjective. In subjective, we have the chief complaint of sudden onset of chest pain, diaphoresis, and nausea. And the pain is not subsiding, but it is increasing with time. We only have the history that the patient has been having pain and nausea for an hour and acute myocardial infarction symptoms. The severity of chest pain is increasing. Now, when we move towards the objective, the age of the patient is 44 years old, her weight is not specified, her gender is female. Laboratory findings By laboratory findings, we conclude that the creatine kinase concentration is 118 units per liter and CKMB concentration is 5 units per liter. Okay, so for the assessment, we have now mentioned that the patient's symptoms include sudden onset chest pain, diaphoresis, and nausea. Her electrocardiogram confirms changes consistent of an acute myocardial infarction and other clinical findings are normal. Hence, the levels of CK and CKMB must be monitored accordingly and the pain must be managed first. So, the plan is to do something that decrease the pain of the patient as well as not elevate the levels of CKMB and CK. So the total CK and CKMB levels of the patient are within the normal range for now. However, myocardial infarction cannot be excluded because the levels of CK, which is creatine kinase, will rise with the passage of time. CK serum concentrations are not usually higher until 4 to 24 hours after heart injury, so it seems that they will rise after some time because the patient is evidently having myocardial infarction symptoms. We must opt for some beta blocker treatment option for treating long-term higher levels of creatine kinase. The beta blocker treatment works more effectively when used in the initial stage of rise in creatine kinase levels. We must first suggest that the patient must have to take a beta blocker for managing her long-term levels of creatine kinase so that they may not be increased and decrease the chances of a chronic myocardial infarction. The patient must temporarily avoid the intake of diabetic medications until the creatine kinase levels reach the normal range if they reach a higher stage. The non-pharmacological treatment include the improvement of the health of the patient by taking balanced diet, by regulating the physical exercise along with the diet, and by avoiding certain medications that are elevating or that may elevate her creatine kinase levels. By consulting with the professional, like some statins increase the levels, so the patient will be feeling better after this plan, and the doses must be adjusted according to their weight and her body surface area, etc. Thank you so much.